Now we're going to go ahead and proceed with the proper setup. As you can see here, this is a composite tub. You can see the label composite. Here is the cassette. It's you can distinguish which one is which by looking at this tape and this color code, which is green. Alright? And then what we have here is a plastic wrap with the hemostat and the composite ring clamp. And then in this patch there is the high speed and low speed hand pieces for the proper attachment. And then lastly, composite burrs. Alright, and you can tell because it's red and also marked with the word fillings. Okay? So what we're going to do now is, now that you have the basic understanding what to hold in your hands, Aldrin's going to now demonstrate how to properly set up on the operatory. So please, go ahead, Aldrin. And also, from periodically, what we're going to do is we're going to be zooming in and out from time to time so that anyone viewing this video will get a clear understanding of what the instruments look like and how they are to be arranged. And as you can see there, Aldrin is not taking the handpiece out barehanded. He still has the cover right on the handpiece and attaches it to maintain everything to be infection-free and contamination-free as much as possible. Normally he would be wearing gloves, but for the sake of training and to save time, we decided not to wear latex gloves. But of course, it is very sensible to always have your latex gloves on when doing the proper setup. And very, very critical, must always have barrier sleeves on. I wish to maintain, not only to follow OSHA regulation, but if you were a patient here, you would want this for yourself. So please, be very attentive to OSHA and infection protocols. And he has removed typically about 3 to 4 strips of gauze. No more is needed than that, and no more than 4 cotton rolls. We do not need, unless we need more, the doctors will let the assistants know exactly how many more gauzes and cotton rolls are needed. We do not want to be wasteful in our materials. We want to be as conservative as possible. And right now Aldrin is scooping up some topical gel on a Q-tip. Again, maintain infection control. Do not make sure that your fingers do not go inside the container. Make sure that everything is cleaned. And that was just the articulating paper that Aldrin has just attached to the articulating instrument. And then Aldrin pulls out a little Dixie cup, which acts as a miniature trash can. And now he's over at the composite tub. And we'll go ahead and zoom in and get closer so you can see the fine details here. There's a little liquid dish, to one for the primer and one for the bonding. And he's going to go ahead and place in the red and yellow microbrush right into that little slot. And there is the composite dispenser. Oh. And you can see here, he set up a tetric flowable composite, which is the one in the black dispenser. And then this is the glass ionomer, which is also called Inaseal, which acts as a base for any deep caries. And then also he stripped up, tied together a piece of dental floss. All right, and it always has about 1 or 2 carpules of extra composite in case that's needed. And then next, he's pulling out the composite ring. We're simulating a class 2 composite, the one sectional matrix band, and a wedge. Now understand that every clinical situation is different. Some will require different types of rings, but for the sake of training, we are going to just focus on a standard class 2 composite setup, and we'll discuss the additional changes on different types of composite at the end of this video. So, and then go close and zoom in. And this is the burr setup. As you can see here, there's the polishing burr for interproximal, the disc, cone shape. This is the flame shape burr, the cone shape diamond, the football diamond for adjusting the occlusion and removing any sharp edges. This is the green. This is another flame shape burr, except this is green, designed to do more aggressive tooth reduction. Round diamond burr, a 330 burr, and this is the straight 557 burr, diamond burr, and this one is the 830 pear-shaped burr, and this is the 4-round. This is the 4-round high-speed carbide burr. This is the 4-round slow-speed, 6-round slow-speed round burr. All right. So knowing that, we typically start off with an 830 burr. And then the 4-round slow speed. And we place the bib. Everything's covered, ready to go. Always want to make sure that syringes are usually covered, because we want to make sure that patients do not get too startled over what they see, because they don't understand everything. So you want to make sure you provide a very comfortable environment for them. And lastly, if you can demonstrate the Snoop drop, the caries detector. And the last thing that needs to be displayed is caries detector liquid. And this is designed to help the doctors check to make sure if there's any caries left, and we'll show that as we go through the sequence. Okay, so just to take a quick look, I'm going to take off the bib here, and we wanted to show you here, this is the complete setup on what a composite is to look like. And this is our intraoral camera, which is already prepared, which will be used where we take photos for our patient. And now, lastly, we'll also get the light cure device, which is what we use to cure our composites, plus the shielding. And here is the UV light that will be used as a light cure to make sure that all of our composites are being cured during each step. And here is the protector, eye protector, when curing the composites with the UV light. All right. So this is the complete setup. So just take a moment to observe, and we will move on next to the mechanics of how to properly assist the doctor with a four-handed dentistry.